Good afternoon, I'm Karen Hershey, and thanks for joining us for our live webcast with world-renowned eye surgeon Dr. Arun Gulani. Today we're going to be talking about advanced cataract surgery. According to the National Eye Institute, cataracts are very common, especially in older people. By the age of 80, the Institute says more than half of all Americans will either have a cataract or will have had cataract surgery. Cataracts are also the leading cause of blindness in the world. Now, Dr. Gulani, you have patients that fly to you from all over the world to have their cataract surgery. You teach this procedure to eye surgeons worldwide, and you also have developed a number of instruments to help in this procedure, so obviously you're the perfect person to talk to when it comes to hearing about the recent advances in cataract diagnosis, surgeries, and these vision outcomes. To kind of start us off, what is a cataract, what causes these cataracts, and how does it truly affect your vision?
Sure. Karen, my pleasure to be here again, and I'm going to try and see if we can answer all the questions that we have from our viewers. The first and most important thing to understand is that cataract is not a disease in most cases. It's a time or age-related change. So if you take the model of the eye for a moment, in this model, if you see, think of your eye as a camera. If you think of the eye as a camera, what's happening is you have a front viewfinder, the cornea, the shape of which we'll discuss later as we talk about how we can do LASIK on top of cataracts. You have a lens in the eye, which is crystal clear actually, clear as a diamond. That's what you're born with. Over time, this lens becomes cloudy. This cloudy lens is now called a cataract. So the very lens that was clear has now become cloudy, and that is called a cataract. So because it was a lens, here's another point, Karen. The cataract, once it's removed, has to be replaced by an artificial lens. So if we understand this concept, the whole system of questions that I'm going to answer today will make a lot of sense. So to repeat in summary, cataract is nothing more than the change in the color of your lens from clear to cloudy, and we have to remove that cataract, put in an artificial lens with a certain power to correct your vision, and that's what cataract surgery is all about.
And actually, you can kind of see the cloudiness in the eye. Does that happen with everyone, or is that something somewhat unique?
No. Cataracts, basically, like I said, is age-related in most cases. There are other causes too, like trauma, patients who've been on oral steroids and things like that, but most common cause is age-related cataracts in patients.
Okay. Now, you've been teaching the concepts of raising this cataract surgery to an art form. Kind of explain these new procedures and where you see this going, and what inventions or instruments you are now using that other surgeons are using in these procedures.
Sure, Karen. Cataract surgery is one of the most common surgical procedures in entire medicine. Millions are done every year. So it is a pretty routine procedure, if you may use that word, which I don't like. But if you take cataract surgery, actually what I like to talk and teach is cataract surgery is an opportunity for an eye surgeon to give the patient their vision that they deserve, that they missed for the last few decades, and keep for the rest of their life. So cataract surgery already is being done very successfully. Patients are having cataracts routinely, seeing pretty good. What I'm raising the bar on is I want everybody, every eye surgeon, to focus on taking that cataract opportunity and making the patient see the best they can, distance and read up close without glasses. Whether that involves newer technologies that we have, like lens technologies that we are using, which are multifocal, that like a progressive glass in the eye, so they can see distance and near. You can also combine LASIK surgery, so you're correcting the viewfinder, the cornea part of the eye. So the whole camera works in tandem, so the brain can see excellent. Now, diagnostic advances that have happened is like the technology that we carry, where you don't have to rely anymore on the doctor looking and going clinically, oh, you have an early cataract, small cataract, let's wait. You can actually do densitometry on the lens, on the cataract, and see how cloudy it is in exact numbers. So you can not only determine the cataract levels earlier, but you can also follow up and see how it's advancing. So patients can take advantage of this technology and techniques when they are ready, rather than they wait till it goes very bad. The instrumentation or classification system that I'm involved with, which we just shared at the World Meeting in Germany, is how you can make it safer, more accurate, and more consistent in outcomes, because that's been my drive. How to take a cataract patient, design their vision for excellence, that too with visual freedom, meaning without glasses. Some of them we just were able to bring, others are too big to bring them here. But for example, this diamond that we've invented, it's made by Bausch & Lomb, a very reputed company. This increases the accuracy and safety. So you saw the diamond that just came out from here, very small. These cut like in microns. You see that little thing there? That's the diamond. And again, there are micromillimeters here, so you can measure exactly how deep you're going to make some incisions and cuts in the cornea. Other instruments, this is also made by a very reputed company. while making the incision, you can actually see like a rear view mirror. My desire for this was to make the incision so repeatably consistent. So you're not just entering the eye anyway, you're actually going exactly the way you want it, and you're seeing like in a rear view mirror, making sure incision is perfect in alignment. All these minuscule, if you may, additions to cataract surgery, I think, raise the bar on the outcome and safety in the final endpoint.
And you actually brought one of your patients here today who just had his cataract surgery, 2 days ago, Mr. Marvin Glassberg, if you want to come up here, sir. Now, from what we understand, Marvin is 74 years old. He was legally blind. He came out specifically to get your expertise and to have a customized surgery. And Marvin, how are you feeling today? Can you see how immediate did it happen? Tell us a little bit about your experience.
Wonderful. It's a phenomenal experience. I've had cataracts, I guess, for a long time. My vision was failing, and it got to a point where I could not see from my left eye, and my right eye all of a sudden was starting to go also. I knew I had to do something. Someone recommended a particular surgeon. I went, I listened to what he said. I did not have the confidence in him, what he was telling me. I knew I couldn't get it done up in New York. So my cousin, who was a patient of Dr. Gulani, she praises him, and she told me, listen, you have to come down here. I said, okay. She told me about the website. I checked the website out. I did more research on Dr. Gulani because I'm a hard person to convince.
That's good.
And I called then, and his staff was the greatest. They answered all questions. They said, please, you have any more questions, please ask. And I had the confidence, and I said, Dr. Gulani is the one. Now, up in New York, basically, most of it would have been covered by insurance. I'm out of that area. There is no coverage. I said, it's worth it. If you want something done right, you just go ahead and do it. You don't worry about anything else. And I came down here. Dr. Gulani performed the surgery. When I first came out of the surgery, he asked me, how are you feeling? I said, perfectly. I said, everything is great. He said, any pain? And I said, no pain, no discomfort, nothing. Everything was perfect.
Could you see immediately?
Immediately, and very well. I saw, he said, what color is this? I told him, I said, I see it very vividly. And when I compared it to the right eye, which still wasn't done, I could see the color, but it was like, there was like a film of gray. But the other, with the eye was just operated on, I saw it perfectly.
So is that what the cataracts do? Do they make it so that you can't see colors?
Right. Karen, if you think about what we started by the whole discussion with, the cataract is where your lens is cloudy. So you're looking through a smoky glass. So think about it. All the color gradations go down in intensity. So your red looks washed out and your bright colors look washed out. Because cataract is a slow onset, many patients get accustomed to it and don't realize this is happening until you do the surgery. So when Marvin called us from New York, he's from New York, he's leaving in a day or two back after his surgery was just done a day ago. The point here becomes is not only are you correcting that part of the vision which is correcting cloudiness, we actually used a special lens for him which instead of being, this is just of course this is not as big as it goes in the eye, a lens, an artificial lens. In his case we used a lens actually that has a design, it has progressive power in the center, like progressive glasses. So Marvin, when I called to check on you in the evening, yes, you said he was doing a crossword puzzle. Yes. So of course I told him, no, please go to bed. And I was thrilled because this technology allows them not only to see distance, this is what we discussed, the art of it corrects the distance and the ability to read. And once you give them that concept of vision, which is freedom for the rest of their lives, I think it's unmatchable.
Tell me a little bit about the procedure for you. How much time did it take? And like you said, you didn't feel any pain, no discomfort. Can you just explain a little bit what it was like?
The first one I can't explain because I was totally out.
Okay.
The second one I remember going into the room, and then I don't remember the procedure being done. I must have been out also. But again, it was apparently very quick, but so smooth that I didn't feel the same.
So when you woke up,
yes,
what was the first thing that you thought of when you opened your eyes and you could actually see and you could see colors? I mean, what was the first thing that came to your mind?
I have my sight back. Thank you, Dr. Gulani. Yes.
What are you most looking forward to now?
Seeing as much of the world as I can.
That's excellent. And you're a big crossword puzzle person, I hear?
Oh, yes, and Sudokus too, yes.
And so you couldn't see it before, so now will you have to use glasses? Do you have to worry about any any side effects or anything that he's going to have to be thinking about right now?
Mostly not, Karen. I mean, with the accuracy that everything's gone with him and the way it works, usually they do very, very well. And it's again a choice for the patient and a choosing concept for the doctor, because there are, like I said, and we'll discuss in our next few questions that we have from viewers, how there are so many lens choices too. That cataract today is not just, I have a cataract, let me have my cataract surgery. Yes and no. In our case, the way I teach doctors, the way I see our patients, it's you have a cataract, but you also are farsighted, nearsighted. You also have astigmatism. You also cannot read up close. Let's correct all those things through that one surgery that you need anyways.
And was his a customized surgery? Were there some unique situations that Marvin presented that other patients maybe don't have?
Yes, and most of the patients do have all this. That's what I'm saying. They need to be corrected
Yep.
because patients are happy even if you do a simple cataract surgery. They're just happy with the clarity. But that to me is not the end point. The end point has to be vision with the freedom from glasses, that too for distance and near. That to me is the goal that should be every eye surgeon's prerogative starting now.
So did you take your glasses and throw them in the fireplace?
Well, I wasn't using glasses. I was forcing myself to read without glasses.
Oh my gosh.
Which wasn't smart. But I had this is a thought. I've seen so many people down here from all over, even from some other countries. The Chamber of Commerce should be delighted with Dr. Gulani.
Well, that's some good advertising there. Well, thank you very much, Marvin.
Thank you.
Have a
It's my
safe flight
pleasure.
back to
You're
New
so
York, and
kind.
we're so
Thank you.
glad that you'll be able to see so clearly now when you get back there.
Great, thank you.
Marvin, it's been a pleasure.
Thank you, Doctor.
Please take care. Have a safe flight. I'll
Thank
see you
you.
back soon. Take care.
Thank you. Now, Dr. Gulani, how are cataracts diagnosed?
Sure. Cataracts usually are diagnosed when an ophthalmologist or an eye doctor looks at your eyes with a special machine called slit lamp, basically a microscope, and they evaluate the unclarity or the cloudiness of your clear lens. But like I said, there are technologies today where we don't have to rely on a doctor's relative diagnosis. We can actually do densitometry on the lens and determine the cloudiness. So that's I think, our next level of diagnosis for cataracts. Second, of course, the vision decreases in a patient to where they cannot drive, their lifestyle is affected. Third is they see glare at night. That's one of the most initial symptoms. They say vision is great, doc, but nighttime when I'm driving, I can't stand the headlights of oncoming cars. And the other thing, like Marvin said, is where the colors start going away or decreasing in their intensity, and patients don't realize that. So
No.
these are the most common symptoms with which they present. And this again becomes an art because many patients who are in their early 60s and are looking for LASIK, they may actually have early cataracts. So it's so important to catch that early change that they're spending on LASIK, they rather do the cataract surgery. Similarly, a patient who's looking for cataract surgery may not be that bad yet. They can still have laser in the late 50s. So you see how every time when we're talking in these webinars, Karen, to me, vision correction is an art of so many techniques and combinations. You cannot narrow down someone to a cookie cutter surgery.
And that's why you offer the customized surgeries.
Oh, it's passion that way, yes.
Well, according to the National Eye Institute, more than 95% of people who have cataract surgery end up with improved vision. So how do you know when surgery is the right choice?
When, first of all, you diagnose the cataract, you know their vision is not improving with glasses, which means the cataract is cloudy enough that it is limiting the vision even despite glasses. That's when it's called clinically significant. More importantly, it's the patient's lifestyle. If they're really not looking at doing active things and stuff, they may even postpone it. But today with these technologies, patients are coming forward and saying, you know what, we want the freedom. And we might as well do it when our cataract is already there rather than wait till too late, because you want to start enjoying your life and be free at that stage. So once the patient's lifestyle decides your diagnosis makes sense, you proceed with surgery. There is no medical treatment as of yet. There are a number of things being investigated, but as of today, surgery is the definitive answer for cataract. And then when you do cataract surgery, my point is that's how you customize the techniques.
Okay, and you offer a no injection, no stitch, no patch surgery. So describe for people what exactly, if you're a patient, what happens before surgery, during surgery, and then after
sure.
surgery?
What we do is we go into the eye. I actually have graphic videos on that, but I'll show you with this because it's easier to explain. So if you see this eye model, your cataract is here, right? It's in the back here. And we enter through a very, very small probe-like instrument, very much like a pen, going through a small incision. And this is all with drops, numbing drops. And like Marvin said, even though it's done with drops and you don't feel anything, you're also mildly sedated. So you really are kind of in a twilight zone. So when we do this with numbing drops and we enter the eye through the cornea, and then we go in and we remove the cataract, and then we, through the same similar kind of instrument like a pen, we inject the artificial lens that unfolds and stays inside the eye. So when we do that, that's basically the surgery, Karen, for cataract. The kind of lens is decided on the condition, and that is what we do with the choice or selection of the multifocals and the different technology lenses that are out there. There are many out there. There is Restore, there is Resume, there is Crystal Lens, there is Technis, and many more evolving technologies that I've tried out abroad. Now, for the patient, the process of cataract is it's usually done in a surgical center, outpatient. Unlike LASIK and laser vision surgery, which is done in the LASIK suite of the doctor's office, this is done in a surgical center, outpatient. Takes a couple of minutes. It's done with numbing drops, and you go in about an hour before. Surgery takes a few minutes, and once you're done, you come out in the recovery room. You're made sure that everything's fine. You go home, and you start putting your drops in for about 2 to 3 weeks after that. No lifting, bending for about 5 days or so, and pretty much you're back on track. Like Marvin will be flying out this week, and I'm fine with that.
That's amazing that it can happen so quickly. I mean, you think about when you have surgery, there's so much healing time, but here he's ready to go and he could see immediately, which is what I think is so amazing.
Right, and again, Karen, that's amazing because of the healing or the surgical techniques, because when you use instruments like these, you're entering the eye in such small area that the healing is not required that much, as opposed to cutting it and stitching and stuff.
Now, how has cataract surgery changed over the number of years, and what options are truly out there for people?
Cataract surgery has changed because of what I said. I think the realm or the paradigm will move in this direction where every doctor will think about vision rather than just let's remove the cataract and put a lens in. So when you're thinking that way, every little thing makes a difference. Entering with the diamond instruments, making sure the entry is not causing any astigmatism, doing the cataract in elegant ways where you're causing least trauma in a nicely efficient way of removing the cataract and putting the lens in. Additionally, further improvements in the ways we calculate the lens power, because the lens power has to be calculated, right? The technologies that we carry to look at the cornea and the lens and match them for the vision. Then further things that I've just tested, which are in US trials right now, is actually lasers are being used for cataract surgery now, Karen. That's going to be the future trend. Everything will be done with the laser. So what is now high-speed ultrasound, which is excellent in itself, will be replaced by laser in the near future too.
Okay, wow. Now, I know you perform LASIK surgery in addition or in combination with cataract surgery, and that's something that's new. Can you kind of explain this new concept and what it means for patients?
It is a concept that to me is a no-brainer, that once you've done a great cataract surgery, what you've done in your cameras, you fix the inside of the camera with a great lens. But you haven't yet corrected the viewfinder. So to me, it makes perfect sense that both these systems should work in tandem, perfectly aligned optically, so you can see the best you can. LASIK and laser vision surgery, Karen, like we repeatedly mentioned on our previous webinar, also is something that I treat as an art. It's nothing more than shaping your cornea from a football shape back to a basketball shape, meaning a perfect sphere. So once you do that with the LASIK surgery, you have now made the viewfinder perfect in tandem with the lens, which is now excellent after your cataract surgery, and the patient sees without glasses. Actually, we have another couple here who's had that concept, and I think this concept will catch on too, that every of these cases we can, in fact, if patients, let's say, had cataract surgery somewhere else, you can actually fine-tune them with LASIK on top too, if it's not a planned stage the way we are doing it.
And let's talk to those patients right now. It's Mr. and Mrs. McCann. Now again, this is also kind of going into the consistency of this. You guys have had this new kind of procedure. I believe, Lynn, did you have it first?
Yes, I did.
You had it first, and then you decided to do it. Kind of explain your guys' experience.
Sure. It all began with a visit to my local eye doctor in Ocala, Florida. And I was diagnosed with cataracts, early stage cataracts at that point. And I said, well, explain to me what all this is. And he then went through the process, much like the doctor has just done, explaining what cataracts are and how they're going to affect you. And I guess the selling point to me was, or the point of concern for me was, that he came back and he said, the sight that you have today is the best that you'll ever have in your life, in the condition that you're in. The cataract surgery is a deteriorating optical phenomena or vision situation. And I said, well, that doesn't sound like a lot of fun.
It does not.
When you say this is the best, and everything from this point forward becomes worse. We then had an opportunity to meet with the doctor, and we talked about the surgery and the way he approaches things and the professionalism that's applied, and said, why am I going to wait a week, a month, a year, whatever, when I can have perfect vision or excellent vision for the rest of my life. It doesn't seem like a decision to me. We were not forced into this. It was a luck of the draw, I guess, as the case is.
Describe your guys' vision before surgery and now after surgery, and what a difference it was, and when did that difference really strike you?
Well, I had the bifocals, and I wore glasses every day, and I had the reading glasses, and you had special glasses for the computers, and you had special glasses for driving, and you had glasses in case you couldn't find them, and you'd get up in the morning and you'd put the glasses on in bed before you got out of there. We had the graded bifocals, and you had to tip your head up or down, and then you'd step off the steps and stumble and whatever. And so it was this constant irritant with the glasses. I spent a lot of time outside working and whatever, in Florida, as we all know, perspiration's a problem. And so you're always fighting with the glasses, and it was just this irritant, constant irritant, and it just kept getting worse and worse. And as I say, with the visit to the local doctor, and he said, you know, this is the best you're ever going to be unless you do something or until something happens, then you react.
So did you have him be the guinea pig
Absolutely.
to see how it would go, and then you decide whether or not to do it?
Absolutely, and it was so easy. It was so smooth. I couldn't believe it, and I went through the same kind of logic as Lynn did then. It was sort of, why would I wait until I'm 75? Why not do this when I'm 62? And then have that many more years of absolutely perfect vision. I don't need any glasses for anything anymore, and never will.
Do you feel 20 years younger?
Well, maybe a couple, not 20. I'd love that, though.
But does it feel good, you know, the freedom from the glasses? I mean, just to be able to wake up in the morning and see your alarm clock, which I cannot do.
No, the freedom to just pick something up and start reading it because it's there, just to be on the golf course and actually be able to follow my ball all the way.
I still can't follow the
I mean,
ball, and I have contacts, and I can't see it wherever it goes.
Yeah, it's
Well, even the
it's
hassle
fabulous.
of putting contacts in and taking contacts out and losing them, and they get misaligned, and I mean that whole scenario thing. And again, it's not elective surgery, because it starts by this diagnosis that you have cataracts and you have this condition that's related to old age. And so you're saying, how do I react to this? You know, I can either accept it and sit around and mope, or I can say, no, let's be proactive and let's go forward.
Well, thank you so much for joining with us and sharing your guys' story. Did you have something you wanted to add?
Well, I was just going to say that we, at our age group, we know a lot of people who've had cataract surgery, obviously. And we are the only people that we know who were given the opportunity to have it so customized that we don't wear glasses. That's Dr. Gulani.
Now, if you have a procedure, Dr. Gulani, like, you know, let's say not like their friend's situation where you've had a cataract surgery and they're still relying on glasses, can they get another procedure to kind of make them less dependent on glasses?
Yes. So again, let's go back to the art of it. There are many reasons for that. Is the lens correct? The lens power that was put into their eye from the cataract surgeon, was that correct? If not, you can correct that lens, you can piggyback on that lens or exchange the lens. Now, if there is a residual refractive error, meaning they're wearing glasses after cataract, you can do advanced LASIK on the cornea, you're done. You bring them straight to the finish line. So we've discussed this many times. I mean, I love the discussions with my patients because they are my feedback always, because that's how you know whether you're doing the right thing, you're really doing excellent work and consistently doing it. So when Mary and Lynn have told me many of their friends they've met who had cataract surgery where they live in South Florida, and they're still seeing with glasses and stuff, that norm has to change. That's what we are saying here, Karen, that we have to aim for vision with full freedom, using cataract surgery as the opportunity, like Lynn said, because there is no other option there. But why not take it to a level of vision without glasses?
So it's just important for people to know that even if you've had a cataract surgery, you've had LASIK or something, and now you have cataracts, there are options out there.
Yes.
You can see. You don't need to necessarily rely on glasses.
Yes, absolutely.
Well, thank you so much for
Thank
being
you.
here today
Thank you
and
for
sharing
having
your
us.
story with us.
Thank you.
Now, are there any risks, Dr. Gulani, with cataract surgery?
Yes, like every surgery. Thank you so much, Mary. I'll see you. With every surgery, there's a risk factor, but cataract, like I said, is one of the most populous surgical procedure in medicine with pretty much a high grade of safety. So barring the normal inherent risk that can happen with any surgery, infection or complication during surgery, most of the time cataract surgery is very, very successful. But still, like I like to say to all doctors, make sure we always maintain the risk-benefit ratio. Just because we're getting such excellent results, we never should get cocky to take a patient who doesn't deserve a cataract yet to surgery. Evaluate the pros and cons, and then the results speak for themselves.
And we already kind of touched on this, but you can fine-tune vision after having LASIK or a cataract surgery. So if someone had it by another doctor, wasn't happy with the outcome, they don't have to think, okay, this is the best it's ever going to be. There are other options out there and other procedures that they can do.
Correct. As long as there is no disease that's causing it, absolutely. Practically every cataract surgery patient who's seeing with glasses now can be corrected.
What do you see in the future for cataract surgery? We kind of touched on that as well, that lasers are the big thing. Explain that a little bit and what other future things are out there for us.
Karen, I mean, everything I talk about in the future is part of it we are involved in it, so that's a privilege given the international abilities for me to do and test things before they even come out in the industry. I think that gives me immense vision, if you may, to look forward and tell my patients, is this the best or should they wait, and etc. Because you don't want to get hyped down by industry jargon. So anytime in eye surgery, I believe the future is where we won't have to go to surgical centers. It should just be right there with a laser, because the eye is such an elegant organ. Just do it with laser with extreme micron precision, leave the patient looking like nothing was done, and they walk away with perfect vision. That's the future. So laser cataract surgery is the future. It's already in the trials right now.
And how does that differ than what's being done right now exactly? I mean, I understand the laser, but is
Sure.
it even, I mean, they have a pretty fast healing time as it is right
Yes.
now. So what is the difference, or why switch when you've got something good? Why go to lasers?
Because even though this is excellent right now, safety, outcomes, everything, laser will literally make it non-surgical in a way. So imagine that, Karen. You're sitting in the exam room, I think, will be the future, where with the laser, everything will happen. There'll be a lens that will be injected like fluid. It'll become jelly and accommodate and everything. That is the future.
Okay.
And the same laser will do LASIK on the cornea. You are done.
You are going to be done. So it's like going in for your little appointment and you just kind of diagnose this and say, all right, we're going to fix it today.
Exactly. Yes.
That would be nice. And I would love it if insurance would cover everything and then you had no problems, which is always really good. Now, is there anything that people can do when they're younger to kind of prevent cataracts? I mean, a lot of it can be family history, diabetes, I understand. Is there anything else that you can do besides those that we can try to do to prevent this from happening, or at least slow the process?
Sure. Even though this is age-related, it is known that sunlight is a factor that can accelerate the cataract formation. So protection from sunlight, like sunglasses, top hats, stuff like that. And of course, diseases, if they are, then that may be one of the first things that turns the red light on about getting to see your medical doctor, make sure there's no diabetes and stuff going on. And of course, trauma and being on steroids or something can accelerate cataracts too. So prevention is still excellent, but cataract is still a time and age-related disease. In a way, it is going to happen to everybody who lives long enough, just like you gave the census from the NIH. So, but the beauty is that today, cataract surgery literally is an exciting time for a patient to turn back the clock. Think about it, Karen. What we've just discussed today, if someone comes in today and says they have cataract, it's actually an opportunity to give them what they've been missing for decades, finally, for the rest of their lives. That's what's so exciting about this.
And if they have the cataract surgery, even at an earlier age, I mean, they say it's, you know, for older Americans, but I mean, it could be, you could be younger and get a cataract. There will probably still be procedures done down the road, as you were kind of talking about age-related vision problems, and you can still have procedures done. It's not like once you have it, there's nothing else.
Like I said, as long as there is no disease, all you're doing is correcting the camera. And there is no limits to correcting the camera, because especially with what we do in our institute, is when you take the whole eye like a camera, you have so many things you can do to fix it with. So you're not stuck with a cookie cutter, I do only this and this. Look at the whole model of the camera. I need every optical component to work perfect so the brain can see. That's the way you look at it.
And because cataracts affect so many people, this was obviously very informative. And if you have any questions, you can obviously contact Dr. Gulani. You can go to our website at askdrgulani.com at WJXT. Otherwise, you can call him, and the number is 296-7393 or 1-888-LASIK-16. And you can also email those questions to gulanivision.com. And we are going to have another webcast next month on September 16th. And that is basically options if you are not a LASIK candidate, because there are many people that run into situations such as myself that were told, oh, you can't have LASIK right now because you have astigmatism or something going on. And as I'm learning, that's not necessarily the case. I could be a candidate, maybe not for LASIK, but for some other procedure, correct?
Absolutely, Karen. Once again, look at it as an art. Most common reason for people coming to our institute saying that being told they're not a candidate is most surgeons are doing only one technique. So now if you're thin cornea, astigmatism, or whatever's going on, you have so many other ways of correcting the vision. Or even combining. You can put in a permanent contact lens in the eye instead of doing LASIK. You can do a no-cut laser vision surgery. You can combine them. No limits. As long as there is no disease, you can be availing of seeing without glasses.
Well, thank you very much for joining us today, Dr. Gulani, and thank you for listening in on this webcast. And remember, September 16th, options if you are not a LASIK candidate, and we'll be here at 12:30 at WJXT. Have a good day.
Thank you again,
Thank
Karen,
you
so much.
I appreciate it.